Hey warriors, you may hear the sound of my neighbor blowing leaves, but focus on the sound of my voice and answer this question. Do you remember the two leading humanistic psychologists? If you said Abraham Maslow and Carl Rogers, then you are on the right track. And we're going to talk about humanistic therapy, and also known as phenomenological therapy, where its goal is to help the client reach their full potential, also known as Abraham Maslow's self-actualization. When it comes to therapy, we're mainly talking about Carl Rogers' tactics. The humanistic approach is based on the concept that people need help tapping into their inner resources and grow and reach their full potential. So humanistic therapies attempt to reduce inner conflicts that interfere with the natural development and growth. So to achieve this goal, humanistic therapists try to give clients new insight. One of the most widely held humanistic techniques has been developed by our friend Carl Rogers. When we talk about humanistic therapy, it's largely Carl Rogers' work that we're going to be drawing upon. Before I get into it, let me just remind you of the state of psychology when it comes to humanist therapy. Up until this time chronologically in psychology, the world had been largely focusing on the unconscious motives, the inner conflicts, according to Sigmund Freud, and then behavioral theories, where the world is a reaction to the rewards and punishments that we receive when we're children, largely focusing on childhood experiences. Maslow and Rogers take a different approach, and I've called them in the past the touchy-feely psychologists because they just make you feel good, and that's one of the places where we have to begin when it comes to therapy. Now, you'll notice one key difference between Carl Rogers in that this is called the person-centered therapy. Up until this time period, people had been called patients, and that gives it a clinical feeling, a feeling of cold, that you're in the hospital, you are a patient. Well, Carl Rogers changed that by calling his people clients. And I know that's a simple twist, but it was large enough to make that person develop that trusting relationship. That's one of the goals of therapy. So a goal of humanist therapy is when the clients find their true selves. And one of the ways they're going to do that is by forming the trusting relationship with the therapist. Rogers says that psychological problems happen when people stop to be their true selves and instead act as others expect or want them to act. Therefore, the role of the therapist is to help clients find their real selves, their true selves, and grow their full potential. So Rogers encouraged therapists to foster the growth by showing genuineness, acceptance, and empathy. By being genuine, therapists will express their true feelings. By being accepting, therapists help clients feel freer and more open to change. And by showing empathy, they sense and reflect their clients' feelings, and therapists can help clients experience a deeper self-understanding and self-acceptance. One ways of doing this is using non-directive therapy, where the client is seen as an equal footing with the therapist, and they work in tandem. They're not inferior, they're not ill. Clients are encouraged to take the lead in therapy, talking openly about whatever may be troubling them. And then the therapist's role is to act as a mirror and reflect back what clients' thoughts and feelings are so that they can see themselves more clearly. Now, the ways that they do this is by using active listening. And active listening is really just what it sounds like. The therapist may ask for clarification on statements that are made by the client. They may use facial expressions and body language that is supporting. The goal is to convey to the speaker that they're being heard and that they're being listened to and that their thoughts and feelings are valid and understood. And then this is the positive psychological mirror that we need in order to see ourselves more clearly. A key part of active listening is unconditional positive regard, and this might be my favorite part of the humanist therapy because it's a part of the active listening that the listener repeats, they rephrase, they ask for clarification of the statements made by the speaker. They're non-judgmental. and they accept and support the client regardless of what they say. They provide for clarification. Unconditional positive regard is I accept you, and it helps to build self-esteem, giving the client the confidence to make his or her own choices and take responsibility for those decisions. If you're ever talking to a school counselor, I believe this is probably one of the techniques that they might use with you: active listening and unconditional positive regard. The thing about unconditional positive regard is it shows that we're going to love you. You might screw up, but we're still going to love you. Our love is unconditional, and that's how I feel about you. Now, seriously, it's the one thing I enjoy about therapy, and what I have enjoyed in the past about therapy. I've seen a therapist when I was going through some stuff. You always have somebody on your side. They'll hold you accountable, and they will tell you, you told me this, but I think that's a load of garbage. Not so rudely, but they'll call you out for your stuff and then help you find a path through that stuff. So humanist therapy probably was what I experienced, and it's very useful if you are seeking self-actualization. Does this work for everybody? Well, the answer is no, because it's usually for people who are more higher educated, for those who are motivated, because remember that humanist is also, Maslow's hierarchy is a theory of motivation. So you're seeking people, these are people who are highly motivated to improve their lives. It treats anxiety, mild depression, difficult relationships, but we're not going to use it with someone who is deeply troubled, major depressive disorder, bipolar, schizophrenia. This would be a no-no, because you're reflecting on your thoughts, and those people may not have the rationale to be able to do that. Overall, humanist therapy is going to be good for somebody who may be mildly depressed, maybe anxious, and need help with going to that next level in the hierarchy of needs.